Hi, this is Dr. Selena Pina with you. Welcome to CVA MS Island Pulse, the Cape Verdean Health Dialogue podcast. This is episode 4. We are excited to present this series focusing on integrative healthcare, the impact of stress, and integration and interactives on how to calm the nervous system. Today, I am pleased to introduce Dr. Patrice Alves, who will share his extensive knowledge on men's health. Thank you for joining us, Dr. Alves. We look forward to having you and discuss this important topic. And I look forward to hearing what you have to say. And perhaps we'll begin with you telling us a little bit about yourself.
Well, thank you for inviting me. So my name is Patrice House. Currently, I practice internal medicine in San Antonio, Texas. But I grew up in Cabo Verde in Praia, and I came to the United States to finish 11th and 12th grade at Madison Park High School, which was in Boston. I went to undergrad school at Northeastern University in Boston, and then
Yay.
afterwards I went to BU. I got a master's of public health there, and then I finished my medical training at Columbia University College of Physicians and Surgeons in New York City. And after that, I returned back to Boston and I did my medical residency at Boston University Medical Center. And then after that, I stayed in Boston. I practiced at Upham's Corner Health Center, which I did for a few years. And then that's after that I eventually ended up here in San Antonio.
Wow. Well, we have a couple of things in common.
Okay.
One is that I began some of my research for my dissertation at Madison Park
Mm-hmm.
with Mr. Gonsalves, the one that wrote the dictionary.
Yes,
Yeah.
indeed.
So he was nice enough to let me in to kind of talk to the students. And I went
Mm-hmm.
to Northeastern University undergrad.
There you go.
Then
Small
I
world.
finished like up in California at University of San Francisco. So I thought we would just begin our podcast with just a few topics. I know it's a vast array of knowledge here and we
Mm-hmm.
don't have that kind of time, but just for us maybe begin with the health, diseases or, I guess I'll start with, heart disease, remains the leading killer of men globally, right? From your clinical experience, what are the most common preventable factors you see contributing to this? And are there patterns in your male patients that concern you most?
Right. I usually tell my patients there are only so many things that we can do to impact our health. I mean, technically, if you think about it, we have our genetics. That's what, the good Lord gave us. But then what we can impact is what we do in terms of how we use our body, whether it's, we're active or sedentary. So how much activity we put in there, exercise or not, but also having to do with what we put inside our body. So having to do with the dietary changes. Obviously, a diet that is better and less in terms of sweets and fats are better. So essentially, the main thing is what you put into your body, what you do about it. That's how it goes from there. Now, in terms of what people can do in general, especially men, well, men, whether they're from Cape Verde ancestry or what have you, they tend not to go to the doctors as much as women do. In my experience, when I see men coming in, especially when they're younger, it's usually when they just become parents, like they're expecting a child or something. All of a sudden, they try to take an interest in their health. But the main thing is to actually see a doctor. And I often tell folks, if you have health insurance, you already pay for it anyways. At least once a year, you should go and get checked. Because, when we think of cardiovascular, we think of the heart and the vasculature and so forth. And the main thing is to make sure your blood pressure is under control. The
Mm.
problem with people knowing about their blood pressure is that you have no idea what your blood pressure is until you measure it. And for example, you can hear stories of people, oh, he was healthy all his life, and one day he just died of a heart attack. Well, that person might not have been healthy if they did not get seen and examined by a physician. So the first step is to get a good step up on good health is to see a physician at least once a year, at which time you get examined, get some blood work done to see how your cholesterol is, make sure your sugar is okay, that diabetes is not a problem. Because blood pressure, cholesterol, and glucose, sugar, diabetes all have a big impact on cardiovascular health in general.
Wow. It just reminds me of another thing that's going on with the younger generation, though,
Mm-hmm.
who don't think about going to see the young men, the athletes. but they're having heart attacks, right?
Indeed, they can. Oftentimes for younger folks, the times they will come to see a physician, it's usually in case there's been an injury of trauma of some sort, or depending how young they are and so forth, if there's some sort of a sexually transmitted disease and all. But the point is for the cardiovascular system, you don't know how you are until you get examined. And unless you get to see a physician to examine, both your blood pressure, your heart, and then get some family history, because that's very important. Because obviously you can imagine if someone is from a family where men, for example, have had heart attacks in their 40s or 50s, that's very significant.
That is, and you bring up another interesting issue, and that's the whole issue of genetics, because not many of us are predisposed to knowing our genetics.
Indeed.
Some of us are very lucky that we do, and
Right.
kind of and understand that, but many
Right.
people don't.
No.
How do you handle that?
Well, the thing with genetics, we start by telling folks, okay, find out what your risk is, because really, in terms of medicine and taking care of people in general, it's a matter of risk assessment and modifying the risk, because you don't really eliminate most of those, you just reduce them. But even though someone's genetic predisposition may put him at a higher risk for certain problems, there are certain many things you can do. For example, if someone finds out early that they have high cholesterol, or if they don't take care of the cholesterol, that the risk for heart attack or stroke will go up, then you'll know, okay, now that I know that, what can I do? Then I can make some dietary changes. You may have to be on medication early to lower the overall risk so that something bad doesn't occur later. So yes, it's important to know about your sort of genetic background and so forth, but then is what can you do to modify that? That's the important part.
Very important. Let's move over to another, I guess, a stressful condition is this whole idea of hormonal health.
Right.
Low testosterone has become much more recognized in recent years. And can you walk us through how you approach a patient who comes in with fatigue, mood changes, or sexual dysfunctioning, what's the connection between this testosterone and
Right.
overall health that men might not realize?
Right, indeed. So oftentimes, actually, people come in is because they've seen an advertisement or something that suggests that they should go. If you have any of those symptoms, they should go and be on a hormone replacement. And some people do need hormone replacement. In fact, many do. But there are also other things that need to be checked out because, if you're tired, fatigued, you want to make sure that it's not because of cardiovascular risk. It's not because of the diabetes and other issues. So the first thing is if someone really says, okay, I want to find out my hormone levels and so forth, and particularly testosterone. So typically what is done is you do a blood test once and you see what the result is. Because if you do the blood test and it's already within range, there's not much to do. But if it's off, then that blood test actually get repeated on a separate day as a sort of morning specimen because testosterone goes up and down throughout the day. And then if that result is then decreased enough to sort of account for the symptoms, because like I said, people can have a lot of other reasons why they can have those symptoms. Mm-hmm. So I often tell folks before you embark on a long course of testosterone replacement, you want to make sure that, so for example, if you say it's because of fatigue, decreased libido, well, if you start getting testosterone replacement within the first few months, you need to notice those things improving, because if they don't improve, then you should not continue replacement for that purpose because it's not helping. And hormone replacement is not without its own risks. To begin with, for example, once someone decides to go on a testosterone replacement, so we're talking about men, we have to make sure that certain things get checked. For example, complete blood count is done initially three, maybe every 6 months. And the reason is because if testosterone level goes too high, that number can increase the red cell count. We can then increase high blood pressure. We can then cause more cardiovascular issue, increased risk of even a stroke. Besides that, the test PSA for prostate-specific antigen gets also checked every like 3 months, 6 months, and so forth, because increased testosterone or testosterone replacement also increase the risk of testicular cancer. Oh. So they're not without risk, but obviously, if the level is low, someone gets a replacement, the symptoms that they describe, they improved, and you follow them, and they're okay, that's the thing to do. One other, just a cautionary note is that, so when we replace testosterone, exogenous from the outside, and people can either get it by, there's a way you can get by a tablet, there are injections, there are patches, and so forth. But when we do that, there's a sort of a negative feedback system where our system, then our body, doesn't make as much testosterone anymore because you're getting from the outside. The problem is that if someone is young in their sort of childbearing age, like say someone wants to be a father, if they go on testosterone replacement therapy, then their bodies stop making their own testosterone. That testicles, essentially what makes the testosterone, can sort of atrophy or shrivel away, and then they may be unable to have children later. So for younger folks, for younger, in this case, I'm talking obviously 20s, 30s, 40s, maybe almost 50. And if they're thinking of then having children, yes, they can have their testosterone augmented, in which case they actually get something so that their body will make more testosterone instead of getting exogenous testosterone from the outside of their body. And
So, I don't know, but it appears that women tend to be more aware of their body. It's because I'm a woman, I guess
and
but there's times too that I'll ignore it, like it's okay, this will pass. But men tend to be even less aware of at least following through on symptoms of cause, of potential things. And just those two areas alone, if they're combining together, they could cause some kind of catastrophe here for a younger person on out.
right.
What do you tell them? I mean, how do you get to them to hear what you just said in terms of how the dangers are?
Right. So the first step, like I said, is to get somebody in to see a physician, do some sort of blood panel and so forth to get an idea where they're at, and then counseling in that. Because if they come in once, and usually, actually, folks who are, in this case, for example, taking testosterone replacement, they're almost like required to see a physician every few months because testosterone is a controlled substance. It shouldn't get written without actually seeing a patient, checking, and so forth. So that's one way to control them.
Okay.
But again, if it's not the testosterone replacement, there are many other things that men in general tend to not go to see physicians as often.
Yes.
I mean, I've had many a patient come to see me and for the first time, and I'll ask them, what's the reason to be here? And they'll look to their spouse and they'll say, well, she made the appointment for me, suggesting that without the spouse, the appointment might not have been made. Other ways that men I guess we could say younger men, get, to the health system is because if they're participating in some sports, they're required to have a physical, but that's a one-time thing and is very specific, and we don't really get to ask them many things about them. But as a rule, I just tell folks, listen, you're paying for insurance. It's not cheap. You should take care of yourself so that later on you can be well enough to take care of your family, take care of your children, and so forth.
Exactly. You mentioned earlier when you're talking about the heart disease that dietary needs are important. And I wonder, we have a lot of very unhealthy foods that are very easy to grab and go for people on the busy schedule. What's your sense of that being one of the impacts of these kinds of things occurring in men's health?
No, it is. And again, men in particular, but humans in general.
In general.
Yeah. So people need to be aware of their, for example, your weight. Is your weight in the desirable range? Is it more than that? Is it morbidly obese and so forth? But in terms of diet, I see people trying all kind of different diets, this diet, that diet, but they're missing the point. The point is not which diet you choose, is the diet that you consume, your regular food and so forth, how you parcel so that you cut down the amount of calories or maintain a level of calorie that's appropriate for your level of activity so you don't gain weight, but also make sure that your diet, for example, doesn't introduce a lot of, say, cholesterol in your diet, fats and so forth. They're going to raise your cholesterol, increase your risk of stroke and heart attack. So it's a matter of making people aware of what's going on, because most of the stuff that you'll get easily grab and go, you're quite right. They tend to be a lot of very high in fat, but also in salt. And salt is we have to think of it as a medication to raise blood pressure. And salt, and some people are very sensitive, and obviously blood pressure can cause problems again, with the heart, you can get heart failure, can certainly have a heart attack, and certainly with the brain can cause a stroke as well.
Exactly. And that's a very scary piece is the whole idea of young people having a stroke.
Yes, they
Are
can
you
occur,
seeing
unfortunately.
much of that in general, or are you seeing in terms of stroke with young men? I mean, high school age or young college?
Usually, again, there may be pockets of certain areas, but usually we don't see that very much. And again, because young folks, if they participate in sports, they should be having some sort of exam every so often. So if we find anything, whether particularly genetic or something that's off, that they can help them out.
Mhm.
But no, people just need to be aware that as we go from children, where our parents are taking care of us, and all of a sudden you become a young adult on, you have to establish healthy habits that continue on
When
in
you,
your life.
when you think of genetics, predisposed genetics for
Hmm.
stroke,
Hmm.
is that something that someone should really be aware of? And that's something to be very concerned with even
Yeah.
at a young age?
So when we think of genetic stuff, obviously genetics, I mean, you're born that way, and some things to me need to be modified to help you along the way. Now, somebody can be born with, say, a cardiovascular problem, like a valvular issue and so forth.
Okay.
But other things that would be more significant for, I guess, the people, the way we're talking now, is if you have high cholesterol in your family, and lots of people have had a heart attack or a stroke or early death, or a lot of family members have had high blood pressure,
Mhm.
and then have had other problems. The idea is just to make sure that whatever your genetic composition is, that you get seen, examined by a doctor to see how you can modify. In other words, what are the things that you can do to make an impact on the way
Mhm.
your body is? So that's the key part.
It's
It's taking
important.
ownership of the way you are and see how to change. And you won't know what to do unless you get seen and you get told what the numbers are.
Exactly. So I guess there's always this little elephant in the room, and it's called cancer screening.
Hmm.
So
Hmm.
there seems to be, well, I don't know. I guess what conversations would you have about prostrate? I'll probably mispronounce these two words,
Hmm.
colorectal and test
Testicular. Yes, yes, yes.
cancer screening.
Indeed, indeed.
What fears or misconceptions do you encounter most often?
Okay, so if you take this to one by one, the earliest one that we worry about is testicular cancer,
Oh,
which, by the way, it's one of those cancers when if discovered early, can actually be cured. I mean, it really is like, I mean, the cure someone may have to have a one testicle removed, but it's actually cured. It doesn't come back. It's gone. So for testicular cancer, because it tends to be younger, we really should be instructing or telling our younger patients, especially after they're no longer seeing a pediatrician, so young men, the usual recommendation is at least once a month while you're taking a shower, you have to palpate your testicle to make sure that there's nothing odd, so that the next month when you check it again, if you see anything unusual, then you go check to see if it's normal or not.
okay.
And that's really, it's kind of almost the same idea we do for women for self-breast exam, because you want to know what it's like now so that if you notice anything different, something gets done. And that's pretty much what we need to do for testicular cancer. And of course, when men go to see a physician, we also examine the testicles regularly just to make sure things are okay. That's the main thing. As for the prostate cancer, normally we think of prostate cancer happening later in men, usually after 50s or even 60s and on. But there may be certain ethnic groups or individuals that are at higher risk. And the way to test for prostate cancer is to do a blood test. But when there's something wrong with the prostate, it manifests in an individual as urinary symptoms. So, for example, the prostate may get enlarged first before it goes to prostate cancer. So that if that's the case, it'll cause symptoms like, for example, for men, getting up at the time during the night multiple times to go to the bathroom, or during the day, what we call urgency, having the sensation that if you have to go, you can't hold, you got to go right away, or urinating multiple times during the day when before it wasn't the case, or someone will urinate and say, as soon as I'm done, I have to go back again. So there's this thing of incomplete voiding, or there's a little discomfort when I urinate, or when I urinate, it's not much at a time, small voids, those kind of things. So those are some of the early symptoms that may be something going on with the prostate, but not necessarily prostate cancer.
Okay.
So the idea is then, even if it's cancer, though, the idea is to catch it early so things can be done, because there's a lot of treatments when it's caught early, especially if it's on sort of younger folks. Now, colorectal cancer, that's very interesting. So it used to be that the recommendation was to have colorectal cancer screening at age 50. And the usual recommendation there was to do a colonoscopy, which is a procedure that you go a few days, a day ahead of time. You drink something, sort of clean you out before you go, and they literally look inside the colon and see if they're finding anything, if there's cancer there. But the recommendation, the thing that has changed, what's changed is now instead of age being 50, we actually lowered it to age 45.
Okay.
And the reason is because many individuals showing up at age 50, all happy. Okay, I'm here to do my first colonoscopy finally. But we're finding many people with cancer at age 45, average 50 rather. That's why I lowered to 45. And for some individuals, if they have colon cancer in their families, usually we tell them, for example, if someone in your family was diagnosed at age 50, you need to be diagnosed 10 years later, like at 40. So if someone is their 40s, you need to go 10 years early, and then do repeatedly to see. And there are other ways, other modalities of checking for colon cancer, but colonoscopy is the sort of tier one. And the reason is because when we look inside the colon, if the gastroenterologist sees what we'll call a polyp, which is a part of the colon that, if left untreated, will eventually turn into cancer, they can actually go and remove that polyp. And once that polyp is removed, that polyp is no longer going to develop the cancer. That's why they can wait years to go check it again.
Very good. So it's really.
But as for what may be causing this, it's interesting. There's been some suggestion that change in diet in general in the population may have something to do with it. But the key point is to get checked early, and have a healthy diet with it. In this case, enough fiber in your diet to allow for sort of regular, soft bowel movements.
Yes, I have had some patients in my practice of mental health who come in because they were diagnosed with prostate, and they're so afraid of losing their manhood.
Indeed.
And not being able to function any longer. And
in all fairness, that's something that does happen, and that's why you want to be able to check everything early so that that's not an issue. Because a lot of the treatments can have significant effect on in this case, erectile dysfunction. But then after that, there are treatments and other things that can be done as well. And just to mention briefly, in terms of what to think, like colon cancer, how do you even know you're going to have it? Well, most people, first of all, if you get checked, you'll catch it early. But symptoms to look for would be something like, let's say someone started all of a sudden have change in their bowel habits, and they're having more sort of constipation than they did before, and it's not getting better. That's a reason to get checked. If someone didn't have hemorrhoids or anything, and all of a sudden, when they go to the bathroom, they're noticing the blood on the toilet paper or in the toilet, that could be something to be looked at. But any change in the bowels in general, or any change in for example, on the stool even, for example, someone may say, all of a sudden, my stools are like thin and so forth instead of usual. That could be colon cancer. So the point is, if there's some change, get it checked out soon and early.
Very good.
Okay.
Wow. So you've mentioned some things that are about preventative care. So there seems to be this persistent stereotype that men avoid doctors until something seriously is wrong. And in your practice, are you seeing this change at all? And what barriers do you still?
I mean, if I look at the patient population that I see, the vast majority tend to be women. This is from younger, because I see people 18 and older into the Medicare years. But more and more though, if people find that there's something isn't quite right, then they can come and stay with us. But the key point is to get patients to go to the doctors, particularly men. And sometimes what helps is actually talking with the men, because they may hear, something happened to this person or that family member and so forth. And then they go in just to be checked, so that either to make sure they maintain their being healthy, or if there's something to be found, then you find it early and checked out. Because getting early is the key point, because there are many cases of colon cancer, for example, or prostate cancer for that matter, And the same thing goes for breast cancer.
Mhm.
If you catch it early, yeah, so it's caught early and something is done, and you avoid major problems later.
That's very good. Good information. Thank you.
Thank you.
Just in the area of stress,
Hmm.
so, what new challenges are you seeing in your patient population, whether it be young, old, male or female, that
Right.
maybe weren't prominent 5 or 10 years ago? And are there any modern stressors, whether it be social, economic, or health related, that are uniquely impacting men?
I mean, folks often think of going to a doctor for their physical health, and they think that's all there is. But health doesn't just mean physical or mental. It's just all together. And in fact, I remember a story from a residency. There was a patient there was a patient in a emergency room. They needed to have what they call a medical clearance before they can go to a psych evaluation. And they kept saying the patient is not medically cleared. The psychiatrist had to explain. It's like, no, he's not cleared because psychiatry is also medicine. The folks in psychiatry have to be medical doctors before they can prescribe medications. And all the other allied health, obviously, whether it's counselor, psychologists, or social work, they all work on your mind. You wouldn't have a body without a mind. They go together.
Yeah.
Now, stress impacts people's life much more than they realize,
Mm,
because someone may say it's stress and not think it's causing anything else. But oftentimes when people are stressed, and it can switch on or include anxiety, but also with stress, people have trouble sleeping. If you have trouble sleeping, not sleeping well, that can affect other parts. It can affect your job now. It can affect your driving. It can affect other things. And as in terms of other things that include stress, I mean, obviously, you have to go in different stages. But for example, interpersonal relationship can cause a lot of stress,
mm,
because for men, for example, um, if something happens that somehow perceived as affecting your manhood in any way, or your ability to do something, so it could be even losing a job. If you're losing a job and then you can't get a job, that's a lot of stress, because you don't feel like you're man enough if you don't get a job or something like that.
mm.
Or if you feel you're not the job to support your family in an adequate way. So there's a lot of things that stress can go on. So financial for sure, that's always been a stress for people more and more. And the world where we are now with so much consumerism, if you don't have money and so forth, that's a significant issue. So certainly interpersonal issues are a problem. Certainly, financial is a problem. So people have to be very, very careful indeed. And
Exactly.
also just being sick can put a lot of other pressures or stresses on people. And it could be anything. It could be from hurting a knee that you can't walk, or if you walk, people look a certain way. It could be that someone has a surgery for something. There's a lot of things that can occur. And we should never underestimate that having a sort of a sound mind in a sound body is what really counts. And you can't really have a healthy body if you don't have a healthy mind.
Absolutely. And I think also in my practice, I'm seeing more men reaching out for therapy.
Indeed.
What do you think about the whole idea of cortisol under this whole heading?
So, the thing with a lot of stuff in the media that people realize, cortisol is not new. Cortisol is a hormone that's been known for many, many years. But when people say cortisol and so forth, that doesn't mean you can go and have a test and say, this is your cortisol level, that's where you are. It's called a stress hormone. And usually in medical practice, it's measured, let's say, it's measured more to see what's going on with the adrenal glands that produce this. So for example, someone is in an intensive care unit, has been sick for many days and so forth. We try to get a sense of how they're doing, because the stress of being ill can cause problems in the adrenals, the cortisol, and so forth, and we need to adjust that while they're there. But for the vast majority of people that are otherwise healthy and walking around, you just need to know, yes, this is hormone. It's a stress hormone, either physical or emotional stuff. Some of this can occur, and then it gets changed, but you don't go checking it necessarily to do anything about. You just make sure to live a sort of a healthful lifestyle, and go from there. But in practice, it doesn't really get checked per se. What's your cortisol level? Just know that it's a hormone, that it happens, that it goes up and down depending on certain situations. But the main thing is to make sure you maintain your level of stress at a healthy level, and that you get seen and checked to make sure there's nothing else, nothing specific going on that needs to be addressed.
Okay. So then my last question, I've listened and it sounds like you integrate a lot of other aspects in your practice. So in terms of integrative, there's a growing interest in combining traditional medicine with holistic approaches. How
Right.
do you approach integrative health with your?
Right. So, most physicians, when we're trained, we train a specific way, and then more and more people are learning about alternative medicine and so forth. So in my practice in particular, I often end up telling people, in medical school, this is what we're taught, that this is what we think should be done, and that's what I'm gonna recommend and suggest. Now, if folks want to try something else, the main thing is you want to make sure that it's not anything that's going to be causing you harm. So, for example, people just say, "Oh, I read about this supplement, that supplement, that supplement." We often tell them, well, listen, if it's not going to interact with the medicines you're already taking, it's probably okay. We just need to keep an eye on it because some of it is not as well thought out. But in terms of integrating a whole sort of holistic approach to health, that's actually should be done informally. People do that. I mean, you shouldn't just have to wait until you go to the doctor to realize what you should do for your health. I mean, it's a lifestyle. It's what you choose to do your whole life. How you how you act or what you do from the minute you wake up in the morning until you go to bed later in that day. Um, and obviously things like exercise, lowering stress, make sure you have adequate sleep, and diet and so forth. Those are all important.
It's all important.
Yeah.
Thank you so much. Is there anything you'd like to add? It's been very informative.
No,
Um,
this has been pretty thorough. I'm glad that you asked all those questions.
well,
And but the main thing I would say is, particularly for men, is that as a rule, like I said, men don't usually go to the doctors, but you know, if you're not a father, you're somebody's child or son, something, or you may have someone that cares for you in a family relationship and so forth. So your body, your health, your mind matters more than you think. It's going to affect a lot of people, and you being healthy and being productive makes a difference in a lot of people's lives, not just yours. So do it for you, do it for other family members, do it for people that love you all around you, could be even friends. But taking care of your health is key because as we all know, without health, you really can't do anything. You need to be healthy first before you can do what you need to do or want to do or aspire for the things you need to do.
yeah, and I might add to that that you have to, we forget that when we're younger, that we are not we're not infallible. And as we get older,
Indeed, indeed.
all those little pickets and stickers start to emerge, and I just thought, like, what's going on here? And
Indeed,
these
indeed.
conditions start taking place, so you got to take care of it before you get
Yeah, yeah,
to get over here, because
indeed.
thank
Indeed.
you.
I mean, we hear patients all the time saying how they could have done this early. It's like, had I known this and that. And
Absolutely.
I know, obviously, I guess someone wise once said, it's too bad that the youth is wasted on the young. Because when we get older, we all want more youthfulness, but it's all gone because we don't have more of it. So we need to
Yeah,
expand it as much as
start
possible.
the patterns now, right? Don't wait
Indeed,
until
indeed.
because it only doesn't get better. It doesn't get
No,
better.
no, no. We are the sum of all the experience we've had. So good
Absolutely.
or bad, it accumulates. So if you
We
want
are what we
to
put
have good
inside of us.
experience, yeah,
Absolutely.
health experience, get a healthy life. I mean,
That's right. Healthy experiences, healthy life. Remember that. So we are going to close with saying we hope you found this experience enriching and thought-provoking. Stay tuned for episode 5 on children's health. Follow us on Spotify and YouTube, CVAMS Health Dialogues at gmail.com. And Dr. Alves, this was amazing. Thank you. And obrigada.
muito obrigado. Obrigado por darme essa oportunidade.
Obrigada. Tchau.
Ok, ok, tchau. Bye bye.